Hi, I'm Tom Marino. At CohnReznick, we believe that all citizens need to be informed about the issues that affect their daily lives. That's why we're proud to support the programming produced by CAUCUS Educational Corporation and their partners in public television.
Funding for this edition of CAUCUS New Jersey has been provided by TD Bank, United Water. Making the planet sustainable is the best job on Earth. QualCare Inc., a local managed care company covering 750,000 New Jersey residents. CohnReznick, accounting, tax, and advisory, where forward thinking creates results. Fedway Associates, the Ohlendorf Center, and by Steve and Elaine Pozycki. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by the New Jersey Business and Industry Association.
Hi, Steve Adubato. It was my pleasure to introduce our good friend, Carlos Medina, who is the chairman of the New Jersey Statewide Hispanic Chamber of Commerce. Good to see you, Carlos.
Pleasure, Steve.
We are doing this program after you returned from a 3-day trip to Cuba. Describe it.
Never been on Cuban soil, so it was very emotional to be there. Beautiful as described, the people very warm, very engaging, very anxious to have ties again with the United States and with their Cuban American counterparts.
Your family connection there, your dad fled Cuba during the Batista administration, yes, right before Castro came in.
Yeah, my grandfather, I believe, was in the military in the administration that Batista took out, so therefore that's when they fled to the United States.
Now, you were part of a group of about 12, an organized situation, right?
Yes.
Everything was set up. Meetings were scheduled.
Correct.
It was very controlled. What did you really get to see?
We got to see many businesses. We got to see an organic farm that employs 100 employees, privately owned. We visited a large facility where artisans and artists display. There had to be 200 private companies there, artists, individuals that make garments. We went to various restaurants. We went to the Chamber of Commerce. So it was very educational.
You told our producers that people looked relatively happy.
They did, and they were very honest. I mean, many people, when you were in a taxi cab, for example, spoke poorly of Fidel and Raul Castro, which I was surprised. They didn't seem to have any fear in expressing themselves. And some two taxi cab rides. One, the individual I asked, have you ever visited the United States? He laughed at me. He said, I wouldn't be here if I visited the United States. I would have stayed there. Right. The other individual said, I have a daughter in Tampa. I've been 10 times to the United States. This is my home. I love it. And I travel back and forth. So two very unique perspectives from two people in the same industry.
Now, it's interesting because you've said that we need to do more, that there are real opportunities between Cuba and New Jersey in terms of building up business trade opportunities. Describe it.
Well, the second largest concentration of Cuban Americans are in New Jersey, other than Florida. And because of that cultural bond, all the individuals I met with in Cuba, they said, we want to do work, with Cuban Americans. You understand us. You're our brothers. You're our sisters. The common phrase was, look, let's let bygones be bygones. We know terrible things happened, but let's move forward.
What do they need from us?
Cuba needs a lot. It needs infrastructure, it needs engineering, it needs construction.
Yeah, so does New Jersey.
Correct.
Cuba needs infrastructure. Our bridges and roads are falling apart. What are we going to give them?
True. We're going to give them expertise, investment, public-private partnerships, which I know you agree would be great for New Jersey, would also be great to work in Cuba to get the roadways and infrastructure. But the tourism, the upside is different than Jersey. I mean, you improve those roads, you bring hotels, there's going to be a lot of money flowing into Cuba just on the tourism market.
What do we get?
What do we get?
Describe what's in it for
opportunities for New Jersey businesses, for engineers, engineers, architects, design opportunities. Opportunities for contractors. Joe Zanzari could be down there building a hotel, building a roadway. Why can't all these great contractors and professionals that are in New Jersey that have a flavor for the Cuban culture because they all have friends. The Cuban community is so large in Jersey. It'll be a natural fit for them to go down to Cuba and work.
So great economic opportunities.
Yes.
So couple sticking points. One, Senator Bob Menendez from Cuba.
Yep.
We interviewed him on public television with his colleague Cory Booker right before Senator Menendez had some very well-publicized legal problems. Senator Menendez has been steadfast in his position on Cuba and the fact that he believes that the administration, the Obama administration, is making all the wrong moves in trying to normalize relations. One issue. Second issue. Governor Chris Christie has said, under no circumstances can the state or should the state of New Jersey have any relationship with Cuba, while Cuba has, in his opinion, harbored Joanne Chesimard, who you know was a convicted killer of a New Jersey State police officer who was never brought to justice. He said, bring her back, let's extradite her for that crime, and then we'll talk. You say what? Let bygones be bygones? Because that's an expression you use.
Yeah.
Governor says no way.
Yeah, understood. I'm not a politician. I have the advantage of not having to have constituents or perception. I'm dealing in what's the reality, what I believe the reality is. You have a Cuban island now that's isolated. Information does not disseminate. It's being blocked. So you open entrepreneurship to these individuals. They're now going to have outside influences.
Sure.
What's going to happen? They're going to have a little money in their pocket. They're going to see what's happening in the United States, and it's going to eventually lead to democracy. Bob Menendez will disagree with me, and that's fine. We're all entitled to our opinion. They want to continue to strangle the economy and continue the embargo. It hasn't worked for 50-something years. I don't think anything's going. What's going to change
But the
now?
Christie argument is not one of politics, but it's one of a moral, ethical issue. You kill a cop, you're convicted of it, you go to Cuba, Cuba harbors you there, you get to change your name to Assata Shakur, and you're held up as a hero there in Cuba, and now we're going to do business.
Yeah.
Christie and a lot of others, particularly cops, say, are you kidding me?
Sure.
That's not about business.
Yeah.
That's about life and death and a cop who was killed.
Sure.
You say...
It's a horrible thing that happened, but I don't know that one circumstance we're going to hang our hat on it, which is, I think, what the governor's doing. I want to talk about many other issues. It is an important one.
If governor says, get past that, let the Cuban government acknowledge that they've been harboring her, and we talk business. You say?
I don't want it to be an impotence to all the other good things that could happen. It is a horrible thing that happened, but there's 11 million people suffering. Am I going to let them continue to suffer because there's a stubbornness on this one point over a horrific crime? I say I want to help the 11 million people that have been suffering for 50 years. I want to help the common Cuban person. I want to see entrepreneurs that live their dream. That's what I want to see. I'm a business chamber. I acknowledge it's a horrible thing. I acknowledge what happened to some of my family who stayed in Cuba during Fidel's time was horrible atrocities that were imprisoned. But let's move forward.
You think it's time?
I think it's time.
And you think Raul Castro any different?
I'm sorry?
You think Raul Castro any different than his brother?
I think somewhat. As soon as he came in, there were more communications with the outside world, definitely.
And his visit with the Pope just the other day,
yeah,
fascinating,
yeah,
saying he may go to church
exactly
after he excoriated the Catholic Church. I mean, it's fascinating.
It is.
Possibilities exist.
I believe there's a lot of opportunities. And part of it is they need us. I'm not going to, Bob Menendez will say suddenly they need us and now they're at the table. You know, let's continue to put that pressure. I'm more of the opinion, let's extend an olive branch and let's try to work and respect each other.
Carlos Medina, you've given us a lot to think about. This issue's not going away. Carlos Medina, chairman of the New Jersey Statewide Hispanic Chamber of Commerce. Thank you so much for joining us, my friend.
Steve.
You got it. Stay with us. We'll be right back right after this. Thanks, Carlos.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD and follow us on Twitter at Steve Adubato.
We are pleased to welcome Lenore Molee, who is Dean of the School of Professional Studies at Berkeley College. Good to see you, Lenore.
Good to see you.
Now, the School of Professional Studies has 4 diverse academic disciplines. Describe them.
That's correct. The first one I'll mention is legal studies. That is a program that prepares individuals that are interested in the legal profession, whether it be as paralegals and legal assistants, or perhaps interested in going on to law school at one point. There is justice studies. Those are individual students that are interested in the justice system, and not only the criminal justice system, but the civil justice system as well. So we have those that are interested in perhaps law enforcement, as well as perhaps working in the social service agencies for governmental organizations, both federal, state, as well as county or municipal. Then we have 2 very different departments, one being graphic design.
Graphic design.
Yes, and the other one being interior design. So they're diverse disciplines, but yet they all have the same focus of preparing students for professional careers, and in professions that are multifaceted. All of these professions are highly multifaceted and provide a lot of opportunities, later on.
Now, there's a new arena, there's a new area of study, a new discipline, if you will, national security.
That's correct.
Why?
Why? That's an interesting question.
What demand is there for a program in national security?
In New Jersey, there are many national security programs being offered. Berkeley has decided to offer this program, and it has been approved in New Jersey, as well as offerings online, to expose students to a different look at the justice system, particularly with respect to emergency preparedness, with respect to resilience, emergency resilience. We've had so many incidences, as you know, in New Jersey alone, where our governmental agencies, our private sector businesses have had to prepare to deal with emergencies. So the students will look at courses that were taken, take courses that will look at preparing infrastructure for those emergencies. We will talk about healthcare emergencies, such as the Ebola crisis that happened.
You'll bring it right into the classroom?
Hopefully we will have case studies, we will have professionals that have dealt with these issues. In fact, we are hosting on May 29th a National Security Forum at Hackensack University Medical Center, where we're bringing in professionals both in the public and private sector to discuss emergency resilience and preparedness with respect to the healthcare sector, and to talk about how these 2 segments dealing with these issues need to communicate. For lack of a better term, there was a lack of communication in dealing with some of the issues.
Lack of communication?
Yes, a lack of communication.
As someone who studied communications and continues to, I would argue, there was confusing communication.
There you go.
We're calling it a lack. How about people didn't know what the heck was going on?
Yeah. Well, that's what the panel will be speaking about.
Okay.
So we have 2 panels. One will be speaking about lessons learned.
Okay.
The other one was speaking about moving forward. So, whenever we study these issues, we look at what was done in the past and how to address them moving forward.
How'd you get interested in this whole thing? You've had a career in academia for a while. Obviously, you were at another university.
Yes.
For a few years.
Yes.
And you came over to Berkeley. Yeah. What caused you to go into academia?
Well, my background, I'm actually a lawyer. So
you admit that?
Yes. So I'm a lawyer, and after practicing for many years, I decided to give academia a try. We all learn from professors that we have gained much knowledge and respect. And having practiced law, I decided to go into an adjunct position and try it out. Well, many years later, I decided that clearly this was something that was right for me. This was the right move for me.
So you're teaching a course.
Yeah.
You say, wait a minute.
Yeah.
I've got the bug.
Yep.
And you said, I'm going all in.
That's it.
You leave law.
Yep.
You start teaching.
Yep.
You get into academic administration.
Yep.
And that's it.
Yeah. There was a point where I tried to do both, which is a very difficult thing to do, as you know. I tried to practice law and also teach at the same time.
Very
and
tough.
I was also the mom of 3 children.
Oh, yeah, that too.
Add that to the mix. So what ended up happening was something had to give. And I do a lot of mentoring now with young faculty in academia. And I tell them, at the beginning, you think academia is kind of going to be a part-time job, and we'll do it on the side. But what happens is it takes over, and I think why, and that was your question, why, it really was the love for engagement. And I have enjoyed that engagement. And when you're an attorney, you engage too, but it's a different type of engagement. And I've enjoyed the engagement with this population. And so over the course of the many years, I've gone and taken that interest out into the community and doing work with service learning and community engagement and engaging my students now in the community.
Let's stay on that.
Yeah.
Because you've also told our producers that in terms of advising students, you've often said to them, do not get pigeonholed into one area.
Absolutely.
You've got to pursue your passion, and you've got to be flexible while you're studying different disciplines. Why?
Oh, so important. In this day and age, you never know, right?
Someone says, a freshman comes in and he or she says, that's what I want to do. You say?
Yeah. Well, I say, sure. If you really truly have a passion for something, then pursue it.
But how often does someone know? Do they know enough to know?
Sometimes they do. Sometimes they do. It depends on the discipline. If when they were in high school.
But in your area?
In my areas, well, I'll talk about design. I do find that the students that come into those 2 programs do have a passion. And they do have I'll call it a gift. They do have a gift. Some of us are artists, some of us aren't, and so therefore some of them decide, I have this passion of art, but I just don't know where to take it.
Would you like students to be flexible?
I think they should. I think they should be open-minded.
What does that mean? Give us an example real quick.
I just look at myself. I started out as a lawyer, right? So I'll use myself as an example with my students, right? I started out as a lawyer, and look, now I'm a professor, and now I'm an academic dean. So you have to keep an open mind, because you never know what a career path is going to open up for you. I think, you would probably say the same, right?
Put it this way, my game plan as to what I was going to do and why or how I wound up sitting in this chair, if I weren't flexible,
there you go.
I wouldn't be in this chair right now.
So that's what college is all about.
Yep, it's good stuff.
Yeah.
Lenore Molee, who is the Dean of the School of Professional Studies at the great Berkeley College. Thanks so much for joining us.
Thank you.
Good stuff, good advice.
Thank you.
Stay with us, we'll be right back right after this. Thank you very much.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
We're joined by Dr. Marc Klapholz, Chairman and Chief of Service, Department of Medicine, University Hospital, and Rutgers, New Jersey Medical School. Good to see you, Doctor.
Thank you. Great to be here.
Let's talk about the Healthy Heart Program at University. What is it?
Well, that's a new initiative at University Hospital in Newark to provide best of care and improve the outcomes of patients with chronic cardiovascular conditions.
Let's talk about heart failure. How serious is the problem in Newark and New Jersey and the country?
Well, heart failure is the number one diagnosis in the Medicare population, and in fact accounts for a lot of morbidity and mortality that we see in the elderly population for sure. And interestingly, it occurs with a greater degree of incidence in the African American community, which is a large population that we do have in Newark and in Essex County.
What are you trying to do about it?
Well, we're trying to bring the best of care that we can to the patient population in Newark and in Essex County, not just by having the physicians provide care, but by creating a multidisciplinary and interprofessional team that can really support the patients in achieving maximal care for their condition.
Break that down a little bit. Those phrases are hard sometimes for people to understand. The first one is a multidisciplinary.
Disciplinary.
Okay, describe that. So give us an example as to what that multidisciplinary team would look like and what impact it would have.
So the team is comprised not just of physicians, but of nurses and nurse practitioners, of pharmacists and nutritionists, of social workers and case managers, of patient navigators and health educators, all who work together as a team to try and help the patient navigate the complex healthcare environment that they're in, understand about their medical condition, access the care appropriately, and get the right medications, which is very tough.
Why would we think that that would have an impact on heart health?
Well, we know that, in fact, one of the major problems as patients have chronic conditions, for example, is getting the right medications, being compliant with the medications, understanding how to take them, what foods they can take them with, what some of the interactions are between medications. So having people that can speak to the patients, patient educators, pharmacists who can talk to the patients really does help improve what patients can do for themselves to improve their outcome.
Doctor, I'm curious about this. A university hospital, what unique challenges do you feel you and your colleagues have in providing the best medical care for the particular population you're serving?
Well, I think that's a very important question. I think that we serve, in large part, an underserved population in Newark, in the city of Newark.
Underserved.
I think people that are socioeconomically challenged. We see issues of patients that can't make it to their appointments because they don't have money for transportation. A simple thing like that, if you can't get to see the physician, if you can't get to see the pharmacist or the social worker, how are you going to really...
That we take for granted, many of us.
That's absolutely true, absolutely
So
true.
what happens?
So we try and understand what the patient's condition is, what their home environment is like, what things they need to really make it work for them, whether it be transportation costs, whether it be getting medications at a reduced cost, and making sure that they understand how to take them and that they are able to do that.
Curious, before I ask you about the Affordable Care Act, which is a question you know you have to be asked, right? Why did you go into medicine?
Well, I think that, to my view of it, and certainly we might have some bias on that, I think it's a profession that really gives you the opportunity to help people regardless of any consideration, and to improve their quality of life, to improve their long-term outcomes, and I think that's one of the great rewards of being in the field of medicine.
Did you know early on?
No, I didn't actually.
You didn't?
I really began to appreciate it once I was into the training of medicine, when I was a medical resident, and I really began to appreciate what we were able to do for patients and for their families to allow someone to have a better quality of life, to live longer, was really a remarkable thing to be able to do for people, and that's when it really gelled for me. So a little bit later than some others, I would have to say.
Let's move from the very personal to the public policy side of things. In the short period of time that the Affordable Care Act has been law, so-called Obamacare, what changes, if any, have you seen in the population you and your colleagues are working with and for at university?
Well, I have seen that patients have been able to get insurance now that they were not able to get previously.
You're seeing that?
We are absolutely seeing that at University Hospital.
So all the naysayers, you don't see it playing out that way for your population?
I do not. We see there's better access to insurance, better access to health care, better opportunity for patients to be comfortable, not to be afraid about following up on their medical conditions, getting the tests they need to have done, getting access to the medications they need to treat their chronic conditions. I think that it is a very important, very useful, and I think in our population been very, very helpful.
Go back to the heart program that you and your colleagues are involved in, the Healthy Heart Program. What, if any, results have you seen in the population you're serving? By the way, the Healthy Heart Program, as you said, does a variety of things to help the population you serve. Any data, anything that we can point to say, hey, there's some real progress here?
Well, what we have shown so far to date, and this is something that's been in effect now for about 2.5 years, we have mobilized a team and have all the team members now involved and working in concert to be able to deliver care. We have enrolled over 250 patients in the program. Our target is 1,000 patients that we have identified. It is a little early right now to really see outcomes. Things we will be tracking include rehospitalization rates. That's a big one.
So reducing rehospitalization rates.
Absolutely. That's a big problem in these heart failure patients. They decompensate because they don't know about the right foods they should eat, too much salt, simple things like that, or not able to get their medications, and have episodes of decompensation that result in rehospitalization, which is a bad medical thing to happen to them. So we'll be looking at that. We'll be looking at their functional capacity. We'll be looking at depression scores to see how they feel about life when they're getting this more holistic approach to their care.
You'll keep monitoring. Dr. Marc Klapholz from University Hospital and also the Rutgers, New Jersey Medical School. I want to thank you for joining us. Extremely important health-related topics. Thank you so much.
Thank you very much.
We learned. Appreciate it. That was good stuff.
The preceding program has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of CAUCUS New Jersey has been provided by TD Bank, United Water, Qualcare Inc., Cone Resnick, Fedway Associates, the Ohlendorf Center, and by Steve and Elaine Pozycki. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. CAUCUS New Jersey has been produced in partnership with TriStar Studios.
Each year, Americans fill 4 billion prescriptions, but as much as 1/3 of that medication will never be used. Some of this waste ends up in the rivers, lakes, and streams that make up our drinking water supply. The United Water Foundation and the National Community Pharmacists Association have partnered to bring you a simple solution. Dispose your meds responsibly. Go to disposemymeds.org to find a participating pharmacy and to learn more. A public service message from the United Water Foundation and NCPA.